Have you ever looked at an NCLEX prioritization question and thought, honestly, all of these patients seem important? If so, you're not alone. One of the biggest reasons nursing students struggle with NCLEX questions isn't lack of knowledge, it's the difficulty of deciding who needs attention first. Today, I'm going to walk you through a simple framework that will help you think more like a nurse and answer prioritization questions with real confidence. Let's start with the basics. Prioritization means deciding which patient needs your attention first. As nurses, we rarely have the luxury of caring for one patient at a time. So we are constantly asking ourselves, who is most unstable? Who is most at risk? Who could deteriorate quickly? And who needs intervention right now? The NCLEX is designed to test exactly that thinking process. The good news is there are clear rules and frameworks that can help you get there. Let's talk about the ABCs. A is for airway, B is for breathing, C is for circulation. Here's how to think about it. If a patient cannot maintain their airway, nothing else matters. Examples are choking, airway obstruction, severe swelling, or an inability to speak. Next is breathing. Signs like respiratory distress, low oxygen saturation, or severe shortness of breath fall here. And then circulation. That includes severe bleeding, shock, and unstable cardiac conditions. Here's an important NCLEX pearl to remember. Airway problems generally take priority over breathing problems. And breathing problems generally take priority over circulation problems. That order matters. Now let's talk about acute versus chronic conditions. The NCLEX loves to test this. Generally speaking, acute problems take priority over chronic ones. Here's an example. Which patient would you see first? Patient A has chronic COPD with an oxygen saturation of 90%. Patient B has a sudden onset of shortness of breath. Who would you see first? The answer is patient B. Why? Because sudden changes are more concerning than stable chronic conditions. What about unexpected versus expected findings? This is another NCLEX favorite. Ask yourself, is this finding expected or unexpected? After surgery, mild pain and mild swelling are expected, but sudden shortness of breath, chest pain, or severe bleeding, those are unexpected. And unexpected findings usually require immediate attention. Let's also look at stable versus unstable. Stable patients can usually wait. Unstable patients cannot. Signs of instability include changing vital signs, altered mental status, respiratory distress, chest pain, and severe hypotension. Here's a quick tip. When you see words like sudden, acute, worsening, or new onset in a question, your prioritization radar should immediately activate. Now let's bring in Maslow's hierarchy of needs. Basic physiological needs always come first. That means oxygen, breathing, circulation, food, and water. Physiological needs take priority over psychosocial concerns, such as patient education and emotional support. Let's put this into practice with a few questions. Question 1, which patient should the nurse see first? A patient requesting pain medication. B, a patient with an oxygen saturation of 82%. C, a patient asking about discharge instructions. And D, a patient requesting assistance to the bathroom. The correct answer is B. Why? Airway and breathing concerns always take priority. Question number 2, which patient should the nurse assess first? A stable COPD patient. B, a post-op patient reporting pain of 7 out of 10. C, a patient with new onset confusion. And D, a patient requesting a blanket. The correct answer is C. Why? New confusion may indicate poor oxygenation, infection, or neurological deterioration. That needs to be assessed right away. Question 3, which patient should be prioritized? A patient with chronic atrial fibrillation. B, a patient with chest pain and diaphoresis. C, a patient requesting water. D, a patient awaiting discharge. The correct answer is B. Why? Chest pain plus diaphoresis suggests a possible acute coronary syndrome. That is a life-threatening emergency. Here's my favorite question to ask when you are stuck on a prioritization question. Who is most likely to die or deteriorate if I wait 30 minutes? That one simple question will often point you directly to the correct answer. Think like a nurse. Think about safety. Think about risk. Let's bring it all together. When you are answering prioritization questions, here is your framework. 1, use the ABCs. 2, look for acute problems. 3, focus on unexpected findings. 4, identify the unstable patient. 5, consider Maslow's hierarchy of needs. 6, always think safety first. And most importantly, don't just memorize answers. Understand the reasoning behind them. That is what will carry you through the NCLEX. If this video helped to clarify NCLEX prioritization for you, please subscribe and share it with a fellow nursing student. Thank you so much for watching, and I'll see you in the next video.